Hello everybody, Chris from the Headache and Pain Management Centre here, and today is day one of National Headache and Migraine Week. Today we are talking about the relationship of the neck with headache and migraine, to make you aware that there are other things that might be causing you headache and migraine that you may not have considered before. Obviously, chiropractors, physios like us have been across this for quite some time. However, the medical profession is actually starting to catch up as well, which is really exciting. So today we're going to explain how the neck might be causing headache and migraine to happen. And if you are a person who believes that their neck might be a contributing factor for headache and migraine, stick around or click the link above here to see what it is that we can do to help you out, or if we might be able to help. So when it comes to headache and migraine conditions, so it used to be thought that it was exclusively a condition because of the constriction and the dilatation of the blood vessels of the brain. Now, while that does happen within an attack, it's not the cause though, it's more of the effect. It's more the secondary thing that happens as a result of the condition. There's still a lot of conjecture out there talking about what the primary causative factor might be, if there is actually just one, or if there are many, if there are several. But one that is showing consistent results, and one that is showing consistent proof, I guess, of concept, is that the top of the neck can be a contributing factor when it comes to headache and migraine conditions. And the way it happens is that you've actually got three joints, you've got muscles, you've got discs, you've got ligaments, you've got a whole bunch of tissues up in the top of your neck. And what can happen is that because of the nerves that supply all of those structures, all of those nerves all feed into the same part of your brain as pretty much anything from here up and over to the back of your neck. So anything from your head, your neck, your face, your jaw, your teeth, your tongue, your lips, anything in that whole area, your trigeminal nerve, can all refer into that one area. It gets packaged up like a big parcel and sent to your brain for processing to do something about it. Now, your brain, we like to think that our brains are actually really good at determining what's going on, but sometimes it gets a bit tricked. So because you've actually got all of these nerves that are coming from your neck, that are coming from your head, your neck, your face, and your jaw into the one spot and shot up, your brain actually can get confused sometimes, and it can allocate nerve input coming from your neck, which your brain doesn't like all that much for whatever reason, and then allocate it and make it into a headache or a migraine. Now, we're still trying to figure out exactly why the brain does it this way, but we do know that it does. There is evidence now to show that if you do treat the neck, it winds down that nerve center where all those nerves go into, and it makes headaches and migraines decrease. At the very least, the signal starts to wind down. So when we're talking about the neck, it's really important to look at a few things to see, or a couple of tells, I guess, if your neck is the cause or could be a cause of your headache and migraine. The first one is talking about whether your headache can swap sides, okay? So if your headache is on one side, it can swap across to the other side in between or during attacks. And the neck should be looked at as a prime suspect. It doesn't guarantee that your neck is the cause, but it's very likely, because the only thing that can cause a headache to swap sides mechanically is the neck. Okay, so if you've got an issue with one side of the neck and then the next day it's the other side of the neck, then you can get pain on one side of the head and then the other day on the other side of the head. So a good tell is that if your headache swaps sides, your neck might be the cause. Another tell could be if you've had MRI scans in the past. So if you've had an MRI scan and everything's all come back clear, and you haven't had your neck assessed in the past, then it's really a good idea to get that done. Because if the MRI is clear, there's no tumours, no strokes, nothing like that, nothing sinister on the scans, that your neck should be the next thing to look at, because the neck is quite commonly ignored when it comes to the causative factors with headache and migraine conditions. So that's the second thing. The third thing, of course, would be an obvious one. So if you get headaches and migraines and you get pain in the neck that comes with a headache or a migraine, it's a really good idea to get the top joints of the neck at least assessed. Okay, so the top 3 joints in particular, but that can also include pain that can come down your neck, down into your shoulders like this as well. If you get pain anywhere in that, either leading up to a headache or a migraine or during a headache and migraine attack, then it would be just obvious to get your neck assessed by someone who knows what they're doing so that you can actually see if the neck is the cause. Now, there's a question here, and of course, if you want to check the link above and fill out that questionnaire, that form, that will give you a very short questionnaire form to see if it is something that can be helped for you and if your neck is the cause. So I get stuck into that. The other thing which could be something to tell whether a headache or a migraine is coming from your neck or not is having a look to see how the headache and the migraine actually start. So we're getting increasing numbers now because of the whole work from home thing. Of people having different work setups, different computer setups to what they had before. And so what happens is that their neck is sort of sitting like this a little bit more during the day. So they're actually sitting forward at the computer rather than actually being in a nice chair, nice setup that they're used to being at work. And if you're sitting for a long period of time in that forward head posture position, or the muscles down the back of your neck aren't strong enough to hold you in a position for a long time, then that in turn can cause a cascading effect, also causing those headaches and migraines to occur. So it's really important to really have a look and see what's going on with how your headaches and migraines start, what the patterns are with the pain, how they behave, to see if the neck is justified in being assessed. In my opinion, it's always justified in being assessed. Now, the question that people do ask is, well, how do we assess it? How is the neck best assessed? Is it a scan? How would you do it? Well, the best way to do it is actually to get it assessed by someone who's very skillful at feeling the joints themselves to see what is happening at those joints. Okay, so it can be that there can be 1, 2, or 3 joints that aren't moving quite as well as what they could be. It doesn't need to be really, really stiff. It could be just a little bit stiff. But if it's a little bit stiff for a very long time, then your brain can be a little bit concerned about that. It can start thinking that there's a problem there, and then the cascade begins. The nerve center fires up, sends a signal to your brain, then depending on genetics, depending on the way that your brain wants to interpret things, could turn into a headache or a migraine from there. And to see if you're a person that might be relevant to, click on the link above and fill it out, and we'll see how things pan out, because it's very likely that if you have those things happening, that your neck could be a causative factor. Hey, I hope that's been really helpful today. It doesn't matter what the diagnosis is, if it's tension headache, migraine, cluster headache, it doesn't really matter too much what the name of it is. What's more important is what are the symptoms and how are they behaving, and could the neck be involved? And certainly from the experience of myself and also my team that have been with me for quite a long time now, it's very, very clear that the headaches and migraines can be caused by issues with the top of the neck. So if you haven't had your neck checked out before, as part of National Headache and Migraine Awareness Week, we are doing this we've opened up more spots with me personally actually to get that all happening, to see if we can help as many people as we can for National Headache and Migraine Awareness Week. So get into that, click the link above, see if it is something that we are able to help with, something that you can get help with your neck, and hey, it might be the one email that changes things for you entirely. I hope that's been really helpful, been really interesting, and tomorrow we'll be back with another video for National Headache and Migraine Week. It's good to join you once again. Type in, like, share, comment below, and we'll see you again soon. Cheers and bye for now.